Hello and welcome to the SRTR Hot Topics session. My name is John Snyder. I serve as the Director of the Scientific Registry of Transplant Recipients, and I'm the Director of Transplant Epidemiology at the Chronic Disease Research Group of the Hennepin Healthcare Research Institute in Minneapolis, Minnesota. Before I begin, I'd like to just take the opportunity to thank Jason Huff for hosting this session and for the organizers of the Transplant Management Forum for the invitation to speak. I always welcome the opportunity to share some of the exciting things we have going on at the SRTR, just to make sure that all of our transplant administrator community understands some of the issues we're facing and some of the things in the pipeline. So thank you for this opportunity once again to be with you virtually this year. A few disclosures before I begin. I do serve as the Director of the Scientific Registry of Transplant Recipients, but the views I express today are not necessarily those of the U.S. Department of Health and Human Services, nor does any mention of a trade name, commercial practice, or organization imply endorsement by the U.S. government. I'm also very proud to serve on the board of directors of Donate Life America, the Organ Donation and Transplantation Alliance, and I'm on the clinical policy board of LifeSource, the organ procurement organization that serves Minnesota, North Dakota, and South Dakota. So I struggled a bit this year in picking the hot topics that I wanted to share with you, but I landed on the idea of just talking about COVID-19. I'm sure we're all fairly tired at this point in the pandemic after a long year to continue that discussion, but I really wanted to share some of the highlights of the application that the SRTR has been hosting for the past few months that details the effect of the pandemic on the nation's transplant system. I just want to make you all aware of that application and walk you through some of the highlights, some of the things I've been monitoring as I watch the pandemic and its effects on the system. Following that, I'll probably spend most of my time today on that topic. But following that, I will talk about how this pandemic has affected the SRTR's performance monitoring, specifically the metrics that go into our program-specific reports that we publish semi-annually that contain things like transplant rates and weightless mortality rates, post-transplant outcomes evaluations for the transplant programs. I won't touch on the organ procurement organization reports today, but we will I'll let you know where you can find information about those metrics as well. And then finally, I want to wrap up with a new initiative that the SRTR is undertaking during this 5-year period to engage key stakeholders in defining metrics of most importance to the transplant community, to each of those key stakeholders in the data that we put forward for the community. So I just want to share a bit about that, just so you're aware of that initiative. It's brand new. Just sort of give you highlights of where we're at and where we're headed with that. All right, so let's jump into some of the COVID data. What I'm showing you here is, maybe you've had the chance to see this before. It's a website that the Centers for Disease Control and Prevention has launched a while ago. This website is actually running for a long time, but they have a targeted area that's dedicated to COVID. And one of the things that I look at from time to time is just this chart that they have available on the site, which shows the weekly number of deaths, which is pretty interesting. You'll notice it sort of looks like a wavy pattern. I think of like waves in the ocean, if you will. And that just reflects some of the seasonality of illness in our country. Sometimes we get more illness in the wintertime, and so you see sort of these rises and falls in the summertime. So peaks in the winter and falls in the summer. The interesting thing about this application on the CDC's website, and the link is shown here at the bottom if you want to navigate to that yourselves. The months or weeks, these are weekly bars with the red plus marks above them, are months when there was a significant increase in deaths compared to what was expected that month if the seasonality trend just sort of stayed as per normal. The yellow line indicates sort of the upper bound of what normal is predicted to be. And so those ones that pop up above the yellow line get those red plus marks as being significantly elevated. This first one at the left here was back in the January of 2018 timeframe. The flu season was particularly bad that year. And so we got these increases of note back then. But of course, your eye is immediately drawn to the right of this screen where you see all of these plus marks pretty much in perpetuity since March of 2020, and where we had this immediate spike when the COVID pandemic reached the United States. We had a drop off, and we had that sort of next wave, and then a drop off again, and then the bigger wave that we were just coming out of at the time that I was preparing this presentation for you. Some of these earlier time points to the right may have incomplete data yet, as this in the CDC website describes that for you if you look at it. But you'll notice, I'm sure many of you have seen this type of pattern before. There was this spike, and then we've had wave and wave of pandemic, and certainly I hope that that we're done with those waves. Hopefully the vaccine can stop the next from happening, but I'm sure you all share my sentiment there that we're hopefully moving to the other side of this. But you'll see that a similar, what happened in the transplant system during this time frame. You all run programs, so I know that I don't need to tell you how this impacted your programs that you are dealing with every day. But from the SRTR's perspective, we've been trying to look at some of the key data points and just think about, what can we learn about how this affected transplantation. And so I wanted to walk you through some of that today. I'm going to show you what we call our COVID-19 evaluation application. And you can find this. This is just an image of our homepage of our website at srtr.org. And under the tools menu, you'll see way at the bottom, there's this COVID-19 evaluation application. Of course, go there and you could find all of the data that I'm going to show you today. We update the data monthly for this application. I do want to point out as well, of course, that the UNOS has a beautiful data visualization Tableau dashboard on their COVID-19 page that has a lot of valuable information about the pandemic as well and its effect on transplantation. But I'll show you some of the highlights from ours. Just you can see some of the things we've been tracking as we watch the pandemic roll through the system. So if you go to that application, you would see this effect of COVID-19 on the transplant system. This is the landing page. I certainly can't get all of the page on one slide for you, but so this is just the top. This gives a brief introduction to the application. And then the key here is that at the bottom, you'll see these different tabs where we have the waiting list metrics, offer acceptance metrics, post-transplant metrics, organ donation metrics, if you want to look at some of the OPO side of the equation. Then there's some definitions and update tracking logs, so you can see what kind of updates we're making over time to the application. We're continually trying to evolve it to provide you with the best information we can. I certainly don't have time today to go through everything that's in here. There's actually a lot of information in there. So I encourage you to just go play through and see what you find of interest. You can find lots of subgroup analyses for all of these metrics, adjusted, unadjusted, time trends, maps, lots of information in there. So what I'm going to do is just show you some highlights. The first thing I wanted to just bring up, which I think really illustrates the effect once the pandemic first took hold, was just this time trend. And so what I'm showing you here is the time trend in kidney transplants by month. And I just wanted to take a minute to orient you to this, because if you bring up any of the time trend plots within our application, they all follow this similar pattern where a couple of things to point out here. There's the x-axis is labeled in months since COVID-19 is the label. And so what does that mean? So a 0 means really this is the 0 time point is when the national declaration of a public health emergency was made on March the 13th of 2020. And so month 0, there's 1 point for each month. Month 0 then would be the first month of the pandemic following that declaration. And so by month 0 here, what we mean is March 13th, 2020 through April the 12th of 2020. And the rest of the dots here follow this same construct. So the next dot over, which is month 1, is April 13th, 2020 through May 12th of 2020, and so on and so forth as you go forward. The charts on the website will interact with you. In other words, so if you hover over any of the points, a little pop-up will pop up that will give you the exact dates that are included in that point, and will show you the exact number that's being plotted there. So I've taken still shots, images, of course, for our presentation today. So months in the negative here would be months prior to that. So, right, so if you can see the time trend for a 12-month period leading up to the declaration of national emergency. And then we've been plotting this forward for each month going forward when we have the data updated. We do show you the most recent month we have, although we, at the far right of the plot, we make that a dashed line because we do have a bit of a data lag. And so I would hesitate to interpret any dot that's past the right. And some might say, well, why don't you just suppress that dot? We thought it would be best to just show the complete data that we have at the time we post the application each month. And for some things like a rate calculation, even though there's less data that we would have complete in that month, the rate calculation may be of interest. So we chose to just show it, but we just caution in the interpretation of that rightmost plot point on the plot. And so what do you see here? I mean, you'll see that counts of kidney transplants on the 3rd month post-declaration had pretty much recovered to where the pre-transplant counts were. And by 2 more months over, it was actually the highest kidney transplant count since at least in the 12 months prior to the pandemic. And so that's held fairly steady. Again, coming into these later months, I'd be interested to see if those points move as our data becomes more complete. But that's an interesting trend. One of the nice things that you can do with any of these time trends is, so in the upper left boxes here, you can see I've selected to show the number of recipients over time and overall. And if you click on this stratification variable of interest, there's many things you can stratify by. I think one of the most interesting for me is to looking at the donor types. Here, I'm just showing you the deceased donors only, kidney transplant counts again, but split out by whether it was a brain dead donor in the top line or a DCD donor in the lower line. And you can see that both types of donors were affected fairly similarly. We saw this initial drop. DCD stayed down a little bit more, which is a bit different from the brain dead donor. Not sure, I don't want to overinterpret that, but I thought that was fairly interesting, and I think reflects some of the anecdotes I've heard about the DCD process being a bit more complicated, at least early on in the pandemic, due to resource constraints within the hospitals. But you see again that most of that looks like it's recovered to pre-pandemic levels after about the 3rd or 4th month. And then if I show you the living donor, I think that those of you working in kidney transplant know this to be true, that the living donor counts were ticking along at about 550 to 600 a month, and then precipitous drop in the first 2 months of the pandemic as living donation. A lot of living donation programs simply ceased operations in those first 2 months. But you see that rebounded nicely in the 3rd month. And perhaps has still stayed a bit low compared to pre-pandemic levels, but recovered nearly back to where it was. You'll notice in the legend, I'll just point this out if you're playing with the tool yourselves, that the legend here actually is grayed out the DBD and DCD and then the living donor. When I asked it to show the data by donor type, it would show all 3 by default. But the nice thing about these plots is you can turn off any lines that you're not interested in by just simply clicking on the legend box, the legend item there. So if I wanted to turn back on the DBD line, I could just click that and it would reappear on the graph. So it's a nice way to just isolate the information that you're looking for. So interestingly, this is the same thing, but now with living donor liver transplants. That's a mouthful. You can see that there appeared to be a drop, but it wasn't as dramatic as in the kidney. So really, I mean, if I took off this vertical dashed line at month 0, your eye might be hard to actually find when the pandemic began. So the living donor liver transplant field really wasn't as impacted as the deceased donor or the living donor kidney transplant field. Certainly, liver transplants are often more urgent than a kidney transplant, given that we have dialysis that can help sustain the lives of kidney patients. So that might be some of what's going on here, but I found it curious that living donor liver transplants did not seem to be affected like living donor kidney transplants were. And if we look at liver transplant counts overall, again, you see this drop in months 1 and 2 of the pandemic and has recovered nicely and stayed fairly high, consistent with pre-pandemic levels by month for liver. Same thing with heart, maybe a drop there in months 1 and 2 again, but recovered and is arguably even to higher than pre-pandemic levels for heart transplants. And some of this, month 3, maybe it's a catch up of procedures that may have been delayed in those first 2 months. Interesting to hear certainly what the experience of the heart programs have been in that regard. And finally, lung did see a bigger drop. Obviously, there was concern that this was a respiratory virus, that impact on lung patients could be worse. And so we did see this bigger drop in the lung transplant population. And arguably, this is, sort of average out that time trend after the pandemic. It still appears to my eye to be slightly low compared to what it was pre-pandemic levels. So just some interesting time trends. For all of these, you can construct maps as well. And so I think, go onto the site and play with it and look at the information of interest to you. So I also thought that it was interesting if we these are data that I pulled from the OPTN website recently. And in 2020, despite this, I think this just speaks to the resilience of our system. There was a record number of deceased donor transplants done in 2020, ended the year at just 33,300 approximately, which was up from 32,322 the year before. That represents almost 1,000 more transplants done in 2020 from deceased donors than in the prior year, which is a 3% increase. However, living donation, of course, was impacted greatly. We saw 1,671 fewer living donor transplants in 2020 than what was done in 2019. And this represents a 23% drop over the prior year. So certainly hoping to see that rebound as well nicely this coming year. But I think it really speaks to the system in general that the OPOs were able to still be retrieving the donors and working within the constraints of those donor hospitals, and transplant programs were finding a way to continue to heal and save lives through those gifts. So I think it's something we should all be applauded for, or you all should be applauded for. So let's take a little bit at the pre-transplant. Let's take a look at pre-transplant metrics here. So similar time trends here. I won't orient you to the slide again. It's the same setup as the post-transplant counts. This is what happened to new kidney listings in the month. Okay, so what we're looking at each month is the number of newly listed kidney transplant candidates. And again, in the first, it's interesting that it wasn't the first month of the pandemic, but really month 2, 3, and 4, where it appears there was a drop in new kidney listings, and then that rebounded up back to pre-COVID levels. And interestingly, in the other organs, to my eye, there isn't a strong drop in liver listings. Perhaps in that first month relative to what was happening before, there was a drop that's ticked back up as we go along, and trends in new heart listings, perhaps a drops in month 1 and 2, and then a rebound. And in new lung listings, these are the ones that appear to still be a bit low, which is interesting. Certainly dropped in those first 2 months of the pandemic, came back up, but still doesn't appear to be at the pre-COVID levels. One could say it was trending down even before the start of the pandemic, which I think is a valid observation. But it'd be interesting to see where that continues to trend going forward. So those were just some of the raw trends pre and post transplant that I wanted to cover. I thought I'd take a chance to look at some of the performance metrics that the SRTR produces around these types of events, both on the pre-transplant side and the post-transplant side, starting with the transplant rate evaluations. And so I'm going to show you some slides that I thought kind of address two questions. One is, did the transplant rates change pre versus post-COVID? I'm sure you know the answer to that, but we'll take a look at the data and see what it shows us, and how were program level transplant rate evaluations affected. You'll see on the application that we do offer in the adjusted analyses a number of looks at if the program level metrics, how they were impacted. Okay, and you can hover around on those plots and get some information about those programs. And so I think there's more available there for you than what I can show you. I will say that sometimes the data set doesn't have enough information in it if we're looking at certain subgroups or certain types of transplants by month, where it might not, the model might not converge, in which case those plots might not show. So just take a look, and certainly you can always email us if you have questions, but I'll show you some of the interesting highlights, at least in my eye. This is the adjusted trend in kidney transplant rates over that same time period. So we're looking at 12 months before the start of the pandemic. Again, month 0 is the first month of the pandemic. We're up to 10 months post data that we have here available now. You don't need me, I guess, to point out the big drop in months 1 and 2 in the adjusted kidney transplant rate. And so when I say adjusted, so we're taking into account the types of candidates that were listed within each month, that were on the list within that month. So each month is sort of what we call a period prevalent look at the wait list, and it sort of rolls ahead. So we're saying, how many person years were there in that month? What types of patients were on the list in that month? And how many transplants were performed in that month. And so you can see the adjustment is made to try to correct for changes in the waitlist population over time, if there are any, try to compare apples to apples across each month. The reference population for any of these types of these points that we're plotting with their 95% confidence intervals would be the month 12 prior to the start of the pandemic. So that's why that one doesn't have any confidence bars around it. But you can see then going forward, was there a significant increase? So there was actually a significant increase in the transplant rate relative to that month, the month right prior to the start of the pandemic. And then of course the drop off, but it rebounded up to a non-significant difference. And then it actually became almost borderline significantly elevated for the next 5 months. And then the most recent data we have shows it to be back about what it was 12 months prior to the pandemic. So quite an interesting trend, I think, in kidney transplant rates. And now this is the type of plot you would see if you go to the program level adjusted. So this is saying, I'll orient you to this a bit because I'm going to show you a couple of these. What's being plotted here is the transplant rate ratios before COVID-19 on the x-axis. Okay, so a transplant rate ratio of 2, for example, would be a program that is transplanting at double the rate that we would expect based on national experience for similar candidates on your list. Okay, so these models are adjusted for the types of patients on your program's list, and it makes that observed to expected type of comparison that we publish in our program-specific reports. And so on the other side of the equation here, if you go back to say a 0.5 on the left side of 1, that would be a transplant rate that is half what we would expect based on what the national performance is for similar candidates. Okay, and so that's the x-axis. Is we ask the question of all the data we have pre and post COVID, that 12-month window pre versus all we have post, what was your transplant rate pre? And then we plot that against what it was in the post-COVID period. That's what's on the y-axis. So we have these cross marks here at 1. So 1 on the vertical is national average before the pandemic, and 1 on the horizontal is national average after the pandemic. And what we're plotting here then is for your program, for each of the kidney programs on this plot, how did their pre-COVID transplant rate compare to their post-COVID transplant rate? And the first thing you'll notice is that these generally do fall right on the diagonal, There's not a lot of spread off the diagonal, which means overall the transplant rates pre versus all of the data we now have post were not significantly, not greatly affected. The dots that are going to be of interest are some of the dots that maybe stick out either on the high side of that diagonal, perhaps some of these up here, even though they're not extremely off the diagonal. Those would be programs that their transplant rate went up after the pandemic. Okay, so for example, this dot here, which is at about 2 after the pandemic, was only at about perhaps 1.1 pre-pandemic. So their transplant rate actually increased, and same with these up here. So the only programs that had decreases in their transplant rate after the pandemic would be some of these programs that are on the low side of the diagonal. And so you could look at those and see what you think of those. But one thing I've thought, is that there isn't a great spread here. So none of the programs in the country's transplant rates were really extremely affected post-COVID. In fact, the ones that had increases post-COVID were perhaps more extreme than the ones that had any decreases in their transplant rate. So I think that's interesting. Let's look at similar data for liver. Okay, so again, in liver, we see sort of a trend here before, and then a drop once we get to the first month of the pandemic. But by the third month of the pandemic at 0.2 here, we see rates that are either higher than they were 12 months prior to the pandemic or about the same. Okay, now all the confidence bars overlap 1, so I'm not making any strong statements here, but they all tend to be elevated. Now, one thing to keep in mind in liver, of course, is that the acuity circles policy went into effect the month prior to the pandemic. Okay, so it's a bit challenging to assess, what of this effect is due to acuity circles being implemented and what of this effect is due to the pandemic. Now, I don't think it's a stretch to suggest that those first 2 dots would be the effect of slowing down transplant due to the pandemic. But I just mention that so that you just keep that in mind as you're looking at some of the liver data. And I've made that note here as well when we look at program-specific effects on that the acuity circles policy started in February of 2020, which was the month prior to the COVID-19 emergency. So keep that in mind. Even so, though, the liver transplant program change in their transplant rate still fall pretty well along this diagonal. Which was interesting. You'll notice that there was one program which is a fairly extreme outlier in their liver transplant rate. And this program actually went in the positive direction though, right? So before COVID, they were just below 1, which suggests that they were at about national average transplant rate, slightly lower. But then after COVID, in the data we have, they were transplanting at 3 times the rate that we expected relative to what other programs were doing. And there weren't any extreme outliers on the low end in the liver transplant space. So it was curious to me that perhaps this point here is a little bit of an outlier on the high side as well. But what we're seeing is, there was at least one program that had a significant increase in their transplant rate. And I use the word significant to mean sort of outlier, stands out on this plot, not in a statistical sense, just for my statistician friends out there to call me on it. All right, in heart transplant, we didn't really see the same level of drop in the transplant rate after we do all the adjustments for the type of candidates. And indeed, by the second, third months post-pandemic, we saw elevations in their transplant rate, and those have been sort of coming steadily down. But certainly the drop, I think one could say that it did drop in that first month of the pandemic, but by the next month it was back to normal. And perhaps this reflects just the more critical urgency of the heart transplant field. And this is what we see at the program level for heart programs. Again, to my eye, no dots that are significantly off the diagonal. Most transplant rates at programs are about the same as what they were pre-COVID at this point in time. And finally, lung. Again, remember, we did see a fairly big drop in lung transplant counts, and so the rate follows that same pattern. We did see a significant drop in the first month of the pandemic, Rebounded nicely, was back up to pre-pandemic levels immediately into the second month of the pandemic, and has stayed either higher or approximately the same as pre-COVID levels. So that's good news in the lung transplant space. And a bit more of a spread in the movement of the lung transplant rate performance evaluations. They still follow along the diagonal fairly nicely. Some of the spread is just due to increased variance for smaller numbers in lung transplantation. But you can pull this plot up yourselves and take a look at those points and find, perhaps find where your program is situated. All right, I'm going to take a few minutes to look at just the same concept for the pre-transplant weightless mortality rate. Now, this is sort of the opposite side of the coin. This is what was the rate at which patients were dying on a given day on your wait list along the timeline of the pre-COVID era versus into the COVID era. Okay, so we did see a significant increase in weightless mortality rates in the first 2 months post-transplant. Now, you might say that, well, that's because we were transplanting less. And I'll just point out that that's not true. Okay, the weightless mortality rates are transplant censored. Okay, so what that means is we're asking the question, if transplant is not an option for your patient on a given day, okay, this is the way I like to explain it, then what is the rate that your patient dies on that list that day relative to the similar type of patient on another list who also doesn't get transplanted that day? So this is sort of asking the question for your, in this case, perhaps dialysis patients that aren't going to be transplanted today, are they dying at a rate that's higher or lower than what you would expect? Okay, so these are because it is a transplant censored evaluation. It's not asking the question, how many people die on your list over time, because that would be a situation that if we were able to increase the transplant rate, those total counts of waitlist deaths would go down. But I like to just describe to the community that the weightless mortality rates are not asking that question. They're asking the question just, of a patient on your list today that is not going to be transplanted, are they higher or lower likelihood of death? Okay, so this is saying that in the dialysis population, there was an elevated rate of death in those first 2 months of the pandemic, but then that has perhaps stayed elevated, but come down to sort of a non-significantly different level in those months going forward. But interestingly, so this, to my eye, reflects that there was this, back to that CDC graph I showed you right off the bat, that there just were elevated deaths early on in the pandemic. And perhaps that's stayed elevated as we go through these waves as well. Again, the program level effects, though, there were not, the kidney programs pretty much lined up so that their post-COVID waitlist mortality experience was very much in line with their pre-COVID waitlist mortality experience. And you can see that here. We didn't see similar trends, though, in elevated mortality for the liver patients. So really no noticeable differences here. Again, acuity circles went into effect right at about the same time. Did the liver program, this even tighter lines up on the diagonal in terms of the program level effects for liver programs. So we're not seeing any programs that had significantly higher waitlist mortality after the pandemic relative to before the pandemic. Same thing here, no noticeable trend to my eye for heart transplant programs for waitlist mortality. And if you pull up the DSA level maps, the heart and lung program level effects models that are trying to make those adjustments for the pre versus post COVID are currently not converging always, just because of small numbers. And so what we can do is we can look at it rolled up to the DSA level. Okay, so we're just basically saying, okay, let's look at what happened after COVID versus pre-COVID for all of the same heart program, all heart programs within a certain donor service area. Okay, so we can map that. So rather than, since I can't show you the program level effects, just wanted to show you just the spread across the country in terms of programs within the DSAs. And one thing to note right off the bat is the high side on this legend is up to a max of about 1.1 and the low side 0.9. And so I think that all of the change, a 1.1 would be a program that, or a DSA area that had a 10% increase in their weightless mortality rate after the pandemic, and a 0.9 would be an area that had a 10% decrease after the pandemic. And so you can see there's quite a lot of areas where the weightless mortality rate actually decreased. Those are the lightest shaded areas. And then some DSAs where it increased. But overall, the spread of that, the range of those values is not great. So I don't want to overinterpret change in weightless mortality rate for the heart programs. And similarly for lung, the spread was a bit wider in lung. Some programs on the high side, you can see in the New York City DSA, for example, was one of the higher areas that had an increase in their lung transplant weightless mortality after the pandemic. But certainly some areas of the country, of course, with decreases as well. So you can see that spread. All right, we're going to touch briefly on outcomes. So one of the things we can plot, and these are unadjusted data here, is just what was the 30-day rate of graft failure. In other words, for patients that were transplanted and they were within 30 days of their transplant during that time point, what was their rate of graft failure? Okay, and you can see that rate pretty steady along there leading up to the pandemic. To my eye, there was a jump up in those first 2 months, which I think jives nicely with what we saw for the overall graft failure rates, which were sort of anytime post-transplant, which I'll get to in a moment. But you'll see that those patients that were transplanted just either right prior to the start, but within 30 days, or that it would transplant within that first month of the pandemic, did appear to have elevated 30-day graft failure rates, and then those came back down. And there was 1 month here, month 8 of the pandemic, perhaps during another surge, that we saw some more 30-day graft failures as well. Interestingly, I pulled up one of the subgroups in that 30-day trend, and you see it in the 65-year-olds and above, and you see it in the 50 to 64-year-olds, but there's no noticeable shift, in my opinion, for the younger age groups, either the 35 to 50 or the 18 to less than 35. And I think this follows generally with what the impact of the pandemic was in the general population, that we saw, of course, elevated death rates in the older patients relative to the younger patients. So I thought it's interesting when our data suggest a similar pattern. This is the trend in overall graft failure rates by program for kidney programs, okay? And so now this is not just 30-day, this is simply asking the question for patients that were alive with function in the period pre-pandemic, the 12 months leading up to the time periods we have after the pandemic, what was the graft failure rate pre versus post, okay? And so you'll see now the points that are on the high side of the diagonal would be programs that had elevations in their graft failure rates. Post-pandemic, you can hover over those points and see who the programs are. At your leisure, I can tell you that some of these dots will line up with areas of the country that were hit hardest early on in the pandemic. So that is interesting. Dots on the low side of the diagonal had their graft failure rates decrease after the pandemic. So we see some spread here, but there were, I think, notably a couple programs on the high side that were impacted by the pandemic early on. So I encourage you to go and play with that type of plot and see what you see there. There's other outcomes plots you can see for the other organs, but I wanted to bring our attention back to the CDC tool. And one of the neat plots that they can do with this excess deaths thing is you can show it which weeks of the pandemic exceeded the threshold in sort of this heat map idea. Okay, so left to right here is starting back in March of 2020 when the pandemic began, all the way to current. I have a week up here till March 13th of 2021, so about a year of data on this one plot. And I just picked some areas of the country that were of interest to me, okay, that I think show the variation in how the pandemic rolled across the country. So the dark areas are places in the country that were being hardest hit, having the highest number of excess deaths just globally. during those weeks. And you see this cluster of darkness to the left here. And of course, this is the New Jersey, New York City specifically. You can see where that pandemic, Massachusetts was early on in the pandemic. And then the white areas of the plot, for example, Massachusetts into mid-June, are areas where they did not have any excess deaths over what the CDC would predict. Okay, so any of these shaded areas are sort of level of excess deaths. There's a couple other dark areas up here to the upper right. Okay, so this is Alabama, Arizona, California that we know was having worse outbreaks into the fall and winter of this past year. And then down at the bottom here, Texas, we know they were impacted midsummer, and you indeed see that here. And then again, in the late fall surge as well. So I found that very interesting. Now, so what does this mean for the SRTR? We have an SRTR review committee that has been monitoring these analyses that the SRTR performs and trying to make an assessment of what is the right thing to do for publication of performance metrics that the SRTR is charged with doing per the final rule and per our contract with HRSA. And just given the unprecedented nature of the pandemic, in the January 2021 reports that were just published recently, our committee recommended that we not include any assessments beyond March 12th. In other words, we're stopping all follow-up on the day prior to the national declaration of emergency. And so what that means for post-transplant outcomes evaluation, it's important to note that for the current one that's there, it still includes all of the 2.5-year cohort, which ends on December 31st, 2019. So that's normal. But normally we'd follow 6 months beyond that, right? So we'd go out until, we'd go out until June of 2020. But this recommendation not to do any follow-up past March 12th has caused us to remove the last 3 months of patient follow-up. So in other words, the full cohort is being evaluated, but a maximum follow-up date for those first-year outcomes would be March 12th, 2020, rather than June 30th of 2020. So you can see that we're carving out just under 3 months of data there in the follow-up space. For weightless mortality, transplant rate, overall survival following listing, the cohorts are all truncated at March 12th of 2020, similarly for offer acceptance. Now, the review committee, of course, is monitoring this and discussing it at each of their quarterly meetings. And so recently made recommendations given the data they had available to them for what we should do for the July reports. So I just wanted to touch on that. For post-transplant outcomes, the committee felt that given that other things in the works as well, such as the ending of the amnesty for the OPTN follow-up forms was not completed yet, they recommended continuing to truncate follow-up on March the 12th. So the post-transplant outcomes evaluations will continue to censor follow-up on March the 12th. So the evaluation cohorts now, we start to truncate a bit of the cohort. So we're losing 3 months of that 2.5-year cohort, and all patient follow-up is not followed past March the 12th. For weightless mortality, they were assessing things like, is there evidence of geographic bias in the metrics for the way the pandemic was rolling across the country in terms of the weightless mortality data. And for kidney and lung, the committee felt that there was enough evidence to cast some uncertainty on that. And so they continue to recommend for those organs that we not evaluate weightless mortality after March the 12th. But the committee felt differently about liver, heart, pancreas, and intestine, that the data were suggesting that the risk of bias was lower in these organs, given the data that they're able that they've been able to evaluate. And so they recommended that we resume normal cohorts for weightless mortality evaluations for those organs. For transplant rate, given the effect for most organs in the first quarter of the pandemic, the committee felt that it would be best if we just continue to carve out the first quarter of the pandemic. And so really what that means is we're gonna look at transplants from January 1st, or I'm sorry, weightless candidates from January 1st, 2019 to March the 12th of 2020. And then we would have this gap for 3 months, and then we would resume assessment of the weightless transplant rate from June 13th, 2020 up until the end of December 2020. So there's kind of this carve out period where waitlist experience during those first 3 months of the pandemic are not going to be evaluated. But the committee felt like the data that suggests that transplant rates recovered for all of the organs, and so they thought it was okay to resume removing those first 3 months. Overall survival following listing, the way this is constructed, needs to follow what happens with post-transplant outcomes evaluations. So of course, those will continue truncation on March the 12th. And for offer acceptance, I didn't have the opportunity today to show you offer acceptance data. The committee recommended return to normal evaluations for offer acceptance, not seeing alarming evidence of geographic variation around the country in terms of how offers were being evaluated and accepted. All right, enough COVID. In my few minutes remaining, I'm going to just touch briefly on this, what we call Task 5. We have a new contract with HRSA, and I want to just make the administrator community aware of this Task 5. You'll be hearing more about this, but in a nutshell, the task is asking the SRTR to identify metrics to assess national transplantation system performance and support informed decision-making by critical audiences. And so it's a broad 5-year task. This is really the intent by HRSA, is that in this first year of the contract, this year, we're working on a plan for accomplishing this, and that we are leading up to a consensus conference in year 2, where we're going to try to bring multiple stakeholders together to have this discussion about what metrics can the SRTR be providing to each of those stakeholder groups. For example, patients, family members of transplant candidates or recipients, deceased donor family members, transplant programs themselves. What types of data would you all like to be presented to you, and should that be public or private? The payers, how are the payers using these data? What data is important for them to see? Regulators, the government, CMS, we're inviting to the table to hear their opinions of what types of data they find helpful. But the idea is that we'd bring that all together in a consensus conference in year 2, and then we would implement recommendations of that consensus conference in years 3 and 4, and evaluate the effectiveness, collect feedback, and then this initiates a cyclical loop where we would then go back and host another conference in the 3rd year, and then implement for 2 years. And HRSA would like us to continue hosting these conferences about every 3rd year going forward. And I think this is a fantastic way to engage the community formally and to hear from multiple stakeholders. We are also, as part of this effort, under the leadership of Dr. Allison Hart, who is our SRTR Senior Staff for Patient and Family Affairs, going to be conducting a number of patient focus groups in the year leading up to the consensus conference, so that we can collect that voice and have that shared as well at the consensus conference. And so we're really looking forward to this process and hoping that you will engage with us. Just where we are now, we did form a steering committee, and for this, we just went out and identified a number of key stakeholders with HRSA, and invited membership, 1 or 2 members from each of those stakeholder groups to help us plan. And we're calling this our Task 5 Steering Committee. And you can see those names here of those that are participating. We just recently held our kickoff meeting. We're going to be meeting monthly to lead up to the consensus conference. This group is going to help us really shine and host the best consensus conference we can. It's a challenging task. The metrics are a constant source of debate, and the SRTR is committed to trying to find the metrics that best reflect what the stakeholders want to see. And so I just encourage you to ask us questions, get involved. As we work up toward that conference, we'll try to keep everyone well informed, but at least wanted the transplant administrators to be aware of what this is and where we're headed. So certainly shoot me an email if you have any questions about that. And with that, I will conclude my hot topic session. I'm happy to take questions following the presentation. Thank you all very much.